Welcome to the world of U.S. healthcare billing cycle, which is the most confusing system in the world. But don't worry. In the next few minutes, I'll explain it step by step in a way that is simple, crystal clear, easy for anyone to understand, even if you are fresher, with real-world examples and zero confusion. We'll make it a little fun along the way, so learning does not feel heavy or boring. And yes, this is exactly how AR callers work in real life. Now, let me take you behind the scenes and show you exactly how money actually moves inside the US healthcare system, from the moment a patient walks into a hospital or physician's office to the moment the provider finally gets paid. This entire journey is known as RCM, Revenue Cycle Management. RCM is simply the money journey of a patient's treatment. This journey does not start after treatment. It starts before the patient even decides to visit a doctor, and it ends only when the provider receives every single dollar they are supposed to get. That money may come from the insurance company, the patient, or both. But RCM is not complete until all of it is collected. Now let's understand this with a simple example. Think of RCM like a water pipeline running from the hospital to the payer. If even one pipe is blocked or leaking, the water never reaches the end. No matter how much water you put in, nothing gets collected. RCM works the exact same way. If one step fails, the money flow stops, or gets delayed, denied, or lost. Now let me walk you through each pipe in the RCM system, exactly how it works in real life. The same way AR callers identify blockages, fix them, and recover payments every single day. There are 8 possible steps in RCM. Step 1 is insurance verification. In this step, we check, is the insurance active? Will insurance pay for this visit? And how much will patient pay for the treatment? Step 2 is patient registration. In this step, patient details are entered into the system. This includes patient's full name, date of birth, insurance card details, photo ID information. Even one wrong or missing detail can cause the claim to be delayed, rejected, or denied, which directly impacts payment. This is why accuracy at this stage is critical in the revenue cycle. Step 3 is medical coding. In this step, we convert the doctor's documentation into codes that the insurance company understands, because insurance works only on code language. For example, when a doctor writes what treatment was given, if the doctor treats fever, a medical coder converts this into the R50.9 diagnosis code. It is like translating the doctor's handwriting into the insurance company's language. Step 4 is charge entry. In this step, we decide how much money to bill for each service, and then we enter the patient details and all required codes into the billing software. This includes procedure codes, diagnosis codes, modifiers, units, charges. Step 5 is claim submission. In this step, we send medical claims electronically to insurance companies, Medicare, or Medicaid to request payment. If the claim is clean, meaning all information, codes, and documentation are correct, the payment is processed faster. If the claim is not clean or contains errors, missing information, or inconsistencies, the claim may be delayed, rejected, or denied. This step is critical because it directly impacts cash flow and turnaround time. 6th step is claim adjudication. In this step, insurance company reviews the claim in detail. They check the patient's policy benefits and coverage rules, apply the provider-payer contract terms very carefully, validate codes, modifiers, units, and medical necessity. After this review, the insurance company decides the payment outcome. They may pay the claim in full, pay the claim partially, due to contract adjustments, copay, or deductible, deny the claim, request additional information, such as medical records or clarifications. 7th step is payment posting. In this step, the insurance company sends the payment. That payment is posted into the billing system, along with the explanation of benefits, EOB, or electronic remittance advice, ERA. This allows the hospital or provider to clearly see how much was approved and paid, how much was denied or adjusted, how much is the patient's responsibility. If the insurance does not pay the full amount, the remaining balance may be assigned to the patient as copay, deductible, coinsurance. After this, the patient is billed for their responsibility. 8th step is denial management. This step comes into action when the insurance company denies or does not pay the claim and gives reasons such as patient not eligible, authorization missing or invalid, incorrect or mismatched codes, medical necessity not proven, timely filing limit expired. This is where the AR caller enters the scene, like a warrior. The AR caller contacts the insurance company, analyzes the denial reason, identifies and corrects errors, submits corrections, or appeals with proper documentation, and follows up continuously until the payment is released or a final resolution is received. Now you can clearly see, revenue cycle management is not a straight line. It is a cycle made up of connected steps, where every step depends on the previous one. One mistake at the beginning does not disappear. It travels forward and shows up later as a delay, a denial, or a revenue loss. Let us wrap up. Insurance verification decides whether the visit can be paid at all. Patient registration decides whether the claim can even be processed. Medical coding and charge entry decide whether the insurance will understand and accept the claim. Claim submission and adjudication decide how fast and how much money comes back. Payment posting decides whether balances are identified correctly, and denial management decides whether lost money is recovered or written off. That is why AR callers are not just follow-up agents. They are the final safeguard of revenue. They find where the process broke, fix what went wrong, communicate with payers, protect timely filing limits, and push claims to resolution. Now, if you master this revenue cycle, you don't just work in healthcare. You control revenue, you become valuable, you become irreplaceable. And trust me, hospitals don't survive on treatment, they survive on payment. If you want to build a stable, high-growth career in U.S. healthcare medical billing, this is the perfect place to start as a professional AR caller. Join our industry-aligned AR caller training and gain job-ready skills to excel in the U.S. healthcare billing field with real call practice, expert coaching, and placement support. Link given in the description to join this training.